my slides, and at the end, I'm going to leave plenty of time for questions. So hold on to your questions, put them in the chat, and we'll get to them afterwards. So I am a vascular surgeon. I come to New Jersey via the University of Michigan, national champions in football 2024. I trained at Stony Brook University Hospital for 7 years and 11 years of surgery and vascular surgery, and then spent time in Texas at Texas Tech University doing a senior fellowship in vascular and minimally invasive vascular surgery. And here I am now 20 plus years at Valley Hospital. So tonight we're going to talk about varicose veins, and we're going to go over causes. We're going to go over signs and symptoms. We're going to talk about complications of varicose veins, how we evaluate them, and what are the treatment options. So normal anatomy, our veins, as most people are aware, they collect the blood from your legs, and their job is to bring it back straight from your leg right up into your heart. And the way our legs drain, we all have two systems of veins in our legs. One, we have our deep veins. These are very large veins. They're literally the size of my thumb, and they're buried deep down in the muscles of your leg. You can't see them, can't feel them. These are the veins that you hear about people getting blood clots in, or deep venous thrombosis, and those things can be dangerous. But those deep veins, they have nothing to do, generally speaking, with varicose veins. So when we're talking about varicose veins, we're talking about the second set of systems of veins in our legs, and that are the superficial veins. Superficial meaning they run under our skin. And the way we're all built, we have two systems. The way we're all built is superficial veins. There's one main trunk that everybody has. In this diagram, you'll see it starts right on your inside ankle. It runs up your calf to the side of the knee and up into the thigh area. And this blood is supposed to be going from your ankle straight up towards your thigh and back up towards your heart. And the reason our veins work so well is inside our veins are one-way valves. These are like little one-way trap doors. So when you're walking and your muscles are pumping and they want to push blood out of your leg and back up to your heart, these valves swing open like a little one-way trap door, and they allow the blood to travel up back towards your heart. If you're just standing still, at that point, gravity will try to push blood in the wrong direction down these veins towards your foot, and these valves will close and prevent that from happening. These valves are very strong, and they function well to prevent blood from traveling in the wrong direction within our veins. Unfortunately, when it comes to varicose veins, what's happening there are these valves inside the veins begin to malfunction. And as you see in this diagram, the veins become enlarged and irregular. And when the valves aren't working, if you're sitting, standing, walking, blood, instead of efficiently going up and out of your leg, is now traveling down the leg in the wrong direction. When that happens, this is what it looks like. That blood starts traveling down the vein in the wrong direction. It's not efficiently going up into your heart. That blood has to go somewhere. And so as it travels down this superficial vein on the inside of your leg, as these curved arrows show, that blood begins to spill out into all the branches. Those branches begin to collect that blood. They get enlarged. And that is what we see here under the skin. So in this is a patient of mine, and I'm going to show you, by the way, a lot of pictures tonight, and they're all my patients. And you'll be able to tell they're my patients because in my pictures, because I'm not a photographer, I'm a vascular surgeon, but I try my best with my iPhone. So in this particular patient, this blue line here represents that superficial vein that runs down the skin. And you can see as that blood spills out, what it's doing now is filling up all of these varicose veins in the leg. So when you see somebody, or perhaps in yourself, when you see all these varicose veins under your skin protruding, that's not actually the main vein. These are just the branches that are filling up because that blood has nowhere else to go. Good news, and we're going to go over this today. This is this same patient about 6 weeks after procedure. And you can see we can actually correct all of that problem right here in our office under a local anesthetic. We'll talk more about treatment options. So what actually causes varicose veins? There's several risk factors. Age is one of them, although varicose veins can happen in teenage years all the way up into your 90s. As we progress in our age, varicose veins become more common. Varicose veins are a lot more common in women than men. Genetics plays a very big role in this. This often runs in the family. As I tell my patients in the office who say, oh yeah, my mother had the same thing, it's not a coincidence. I tell them that is the one thing you're allowed to blame your mother for is your varicose veins. Obesity, if you're carrying extra weight in the midsection, that actually pushes on our veins and impedes the flow back up towards the heart, and that clearly is a very significant risk factor for development of varicose veins. Finally, work and lifestyle. What I mean by that is people who spend a lot of time on their feet. Doctors, nurses, policemen, firemen, teachers, people in retail. You spend hours and hours every day on your feet. Gravity works against you, and it's pushing that blood down in the wrong direction in your leg, and is a risk factor for developing varicose veins. What are the signs and symptoms? When it comes to veins in our leg, first off, what I tell all my patients is varicose veins by themselves, with very few exceptions, are not dangerous. Varicose veins don't cause heart attacks. They don't cause blood clots. They don't cause you to have a stroke. Nobody's losing their leg from their varicose veins. And so for some patients, they have no symptoms. They're just noticeable and they're cosmetic in nature. And we'll talk about options how to deal with that. But certainly, if somebody has a lot of varicose veins, they don't hurt, they're not bothered by them, and they don't particularly care about the appearance of them, they're very safe to leave them alone. But some people actually do have symptoms that are related to their varicose veins. Aching and tired legs, very common. As you can see in this patient, there's a lot of blood sitting in these varicose veins. Patient's leg become heavy, your legs fatigue and get tired because you're carrying a lot of blood in these very dilated varicose veins within your leg. People experience burning and throbbing. Muscle cramps, very common, especially at night. People often have restless leg type symptoms, and that certainly can be caused by their varicose veins. And what people often find is after they correct their varicose veins, a lot of that goes away. With all this blood trapped in these varicose veins, people obviously will get swelling of their leg, which can be quite significant. The other thing that I hear very commonly, and people don't put one and one together, is your veins can become very itchy. As these varicose veins expand under your skin, they stretch. The vein itself, which is already thin, becomes even thinner. It's like a tissue paper. And what happens in those varicose veins is that blood sits there. Some of the blood cells and serum will escape, get under the skin. It can discolor your skin, and it can become quite itchy. So oftentimes, itchiness over your veins is not a coincidence. The last and worst thing that happens in patients is as that, like I was describing, the blood and serum and blood cells that get trapped under your skin, after a while, they have a deleterious effect, and that skin can begin to break down and actually ulcerate and open up into a wound. That's where you don't want to get, because those can be quite problematic to heal. So again, looking at the different, quote, complications of varicose veins, cosmetic, like I said, is in the eye of the beholder. No one really gets into trouble. If you want to leave your varicose veins alone, please do. Some people, like I mentioned, there is swelling, quite a dramatic case here. This is all related to varicose veins. As you see over time, those blood cells escape under your skin and the skin becomes dark and discolored. It starts to become very dry and flaky. All of that, again, related to varicose veins. And unfortunately, the worst stage of this is right around the ankle, is the most common location that the skin begins to open up and actually ulcerate. And besides being very difficult to heal, it becomes very painful and is a risk for infection. So when someone comes to the office, how do we evaluate your varicose veins? We talk with you, we get all this history, signs and symptoms that you may be experiencing, family history, other pertinent medical history, and then physical exam. Not only do we check your veins, we want to make sure your arteries are not an issue also. But specifically in focusing on the veins, we oftentimes, and some of you may have had this before, is to do an ultrasound of the vein. Very simple, small probe, uses ultrasound, some gel to take a picture, completely non-invasive, completely painless, no needles. And we get a very nice, accurate picture of what a varicose vein will look like. And this helps us determine, one, how bad is it? And two, if we choose, what are the options for intervention and to fix this problem? So when it comes to the management, now we've evaluated somebody with varicose veins. Well, how do we manage the problem? A couple of things super important: exercise, excellent. Pumping the legs, pumping your veins is going to help push this blood out of these varicose veins back up to your heart. Weight loss, like I said, excess weight is definitely a risk factor for varicose veins. As you lose weight, the blood will flow more freely from your legs back up to the heart. Leg elevation, super important. Elevate the legs and drain those veins back up to your heart. All those things can be very helpful in terms of managing symptoms, like I spoke about, swelling, the itchiness, the discomfort. But none of those things actually make your varicose veins go away. The other important thing, which nobody likes, is when someone recommends that you wear compression socks or compression stockings. But they are very helpful in the management of varicose veins. And what these compression socks are doing is basically compressing the varicose veins and the malfunctioning veins and forcing the blood out of your leg. Again, very helpful in managing swelling and the other symptoms of itchiness of the skin and the discomfort and the burning. But none of it actually fixes your varicose veins. It's just used more for symptom relief and also to minimize the risk that over time this problem is going to progress. There's a lot of over-the-counter, complementary, and alternative medications. Some of them work quite well. These are some of the more common ones. Vena-Cal is a very popular one you can find online. Horse chestnut is actually been around for many, many years. It was very popular in Europe, and probably over the last 20 years has become very popular in the United States. And it's actually supposed to be quite helpful. Again, doesn't make your veins go away, but it can help control some of the symptoms that are very troubling to people. There's other medications and creams that we use. Dermica is a very popular cream developed by a vascular surgeon and a dermatologist. Excellent to help minimize discoloration of the skin that's associated with varicose veins. Vasculera, again, is an all-natural product that you actually do have to have a prescription for in the pharmacy. But it is very helpful in those patients who have really bad varicose veins, and specifically, I use it in patients who have a lot of skin damage. That's its role. Again, none of these products cure your varicose veins. They simply help with the symptoms that trouble our patients. So what if we do want to intervene and treat these varicose veins? Perhaps in someone, either one, cosmetic, they don't like them, they want to make them look better, or two, people that are really having problems, leg swelling, pain, cramping at night, the skin changes that I described, where their skin is becoming very dark, it's becoming very flaky and dry, and sometimes, like I said, ultimately it ulcerates open until a wound. So we have a lot of different methods, and I'm gonna go over these and kind of describe how we choose what's best for the individual patient. So there's really four main treatments that we use these days. One of them, vein stripping, I'll show you, is more historical, not typically done anymore. But sclerotherapy is very popular. I'm sure people have heard about these catheter or laser ablation type of procedures. And then ambulatory phlebectomy, I'm going to show you, that's how we actually get rid of those visible varicose veins for you. So sclerotherapy, very easy, very tiny little needle, inject medication right into the vein directly. The vein collapses, seals, and your body absorbs it, and those spider veins disappear and go away. There's currently 2 FDA-approved medications on the market that are specifically for this. Quote, back in the old days, people used saline injections and glycerin injections, and they were quite painful and did not work very effectively. These 2 FDA-approved medications, which again have been used in Europe for more than 20 years, here in the United States, probably approved roughly about 18 years ago by the FDA. These medications, pretty painless in terms of burning. It is a very tiny needle. Is that needle totally painless? Well, nothing in this world is 100% painless. Kind of like a bug bite, a mosquito. Patients tolerate it very well. No one's ever kicked me or screamed or cursed at me for doing it. People are usually very pleased with it and are often pleasantly surprised how much it does not hurt. But again, no procedure that we do is, quote, painless. These are some pictures of how this progresses over time. This takes time. This often takes more than one treatment session. Treatment sessions are limited by the total allowable dose that the FDA has approved to be used in a single day. So in our office, the way we do our sclerotherapy is basically you are purchasing a 1 bottle, which is the total daily dose allowed, and we use that to inject as many veins as possible. But even with that 1 bottle, you're not going to get them all. So oftentimes it may take more than 1 session and take several weeks, but you can see as things progress from the left side of the screen all the way to the right, the results can be quite good. How about vein stripping? Vein stripping is a surgical procedure that has been performed for more than 50 years. It's actually done in the hospital. It's done under anesthesia. Back in the day, used to require you to spend the night in the hospital. And basically what we would do is, like I showed you earlier, this is that superficial vein that we all have running under our skin. This is the one that's causing the varicose veins. And basically under anesthesia, we make an incision in the calf overlying that vein. We make a second incision high up in the thigh near the crease of the groin. And basically we have a device that, for lack of a better term, just tears this vein right out of your leg. We close up the 2 incisions, spend the night in the hospital, go home the next day. Although it was very effective in accomplishing its job of treating varicose veins, it was extremely painful. Patients didn't like the scars that were left behind. And so fortunately, welcome to the 21st century, we now have these minimally invasive catheter procedures. And we do this either with a laser or with a radiofrequency catheter. Both do the same thing. And basically what you're doing, instead of tearing out that vein, we do a very simple procedure right here in the office. We numb the skin right overlying that vein, and we take a needle and we put it into the vein. Good news, you don't feel that. Our veins don't have nerves inside. So after the skin is numb, you really don't see a thing. There's no incision made. There's no sutures needed. And basically, by puncturing the skin, we can introduce this catheter, which will either at its tip have a laser, or the tip can have a radio frequency transducer. And what happens is it travels through that vein in the thigh. We do this under ultrasound. We do it in the office, a local anesthetic. You can't feel it. Like I said, our veins don't have nerves on the inside. And what it does is when you turn on that energy inside, it zaps the vein from the inside and closes it up. So instead of tearing the vein out, what we've done is actually seal it up from the inside so this vein can no longer leak down your leg, causing the varicose veins. Good news, when we're done, we take that needle out, we put a Band-Aid on and an ACE wrap, and 30 minutes later, you're walking out of the office. Recuperation, very fast, very easy. So patients obviously would prefer this over the more traditional, old school stripping of veins. Like I said, I've been at Valley Hospital over 20 years, and I can't remember in 20 years having the need to strip a vein. Everybody's treated with these minimally invasive catheter procedures, whether you choose to use a laser or radio frequency energy. Personally, I use radio frequency energy. It causes less bruising of the skin and less risk, but both either laser or radio frequency are equally effective in treating the vein. What do we do about those large veins that you see protruding under your skin? Well, now that we've fixed the underlying problem, which is feeding those, patients ultimately want to get rid of those big, large, bulging veins under your skin. And we do that with a procedure that's called a microphlebectomy, again, done here in the office. We use a local anesthetic over those big veins. And basically, we puncture the skin and we tease those veins out and we actually remove them. And when we're done, we'll put some Band-Aids on those puncture sites. There's no stitches, no sutures. Wrap you up with an ACE bandage, and 30 minutes later, you're off to home. Good news there, very fast, easy recovery. A little swelling, everybody has a little bruising. Take some Tylenol, and the recovery very fast, and it's a very effective treatment. These are large cluster of varicose veins behind the knee. Use a local anesthetic here in the office, puncture the skin, and this is approximately 6 weeks later, everything's gone. You can do even something this extensive. This is another patient of mine. Large chain of varicose veins running down their leg. A local anesthetic here in the office. You can barely see anything left over as a residual. This is about 8 weeks after the procedure. Even with these very large varicose veins, they come out very easy right here in the office. All the patients say, oh, what do they look like? Well, this is what they look like. This is this patient's varicose veins. When they come out of the body, they're all shriveled. There's no blood in there. And so these, believe it or not, are the same veins that you're seeing under the surface when they're all filled with blood. So which treatment is right for you? Well, that's going to depend on a couple of things. And that's what comes up in our evaluations. So patients who have spider veins, or what we call medically telangiectasias, these are truly all cosmetic in nature. They have nothing to do with the main vein under your skin. They have nothing to do with those large varicose veins that people see. These are just typical spider veins. They're all considered cosmetic. Our patients always ask, well, will my insurance pay for this? There's no insurance, including Medicare, that will pay for sclerotherapy for cosmetic reasons. Here's a patient of mine. And like I said, this is a process. And you can see on the right hand of the screen how extensive, and I'm sure you've seen people or perhaps yourself having terrible spider veins that can be very dense, and cosmetically people don't enjoy them. This is a young woman who obviously was very troubled by these. So this takes her other leg, by the way, is no better. So she probably spent, I would guess, 5 to 6 sessions having her legs injected to get rid of all these. But you can see quite a dramatic result. And one of the first questions I always get from my patients is, well, aren't they just going to come back? What about my varicose veins? What about my spider veins? Well, the two things I tell them is after I remove your varicose veins, I'm going to go back a couple of slides, like here. I said, these veins can never come back because here they are, and they're going to be in my garbage can at the end of the day. So those veins will never come back. Same thing with these spider veins. Where I injected these veins, they will never come back because they've been absorbed by your body. Now, does that mean you'll never get varicose veins? Absolutely not. You can get them elsewhere in your leg. Our legs are filled with thousands and thousands of veins. So, as I tell my patients, will you be back to see me in 5 or 10 years for a touch-up? If it's cosmetic, perhaps. I've been doing this long enough that I have plenty of patients come back after 10 years and say, aha, I remember you told me 10 years I'd have a few more veins, and here I am to get them fixed. How about these large varicose veins that we see? Most of the time, these are related to that underlying vein that is malfunctioning. So this patient gets two things which are done at the same time. One is that catheter ablation, where we numb the skin in the cat. We put that needle into the vein. Again, you don't feel it because our veins don't have nerves inside. And we put that catheter into the vein and zap it with radiofrequency energy to seal it. And then at the same time, as you see in this woman's thigh, we numb the skin, we make some punctures, and we remove those veins. And then in one session, everything is treated for this patient. When it comes to just cosmetics, we see quite a few patients who just come in for cosmetics. And, everybody thinks about their veins in their legs. Well, we have veins all over our body. And just a couple examples of what we can do here in the office. These are veins treated from the hand. And frankly speaking, I've never, this is only women. I've never had a man ask me to take the veins out of his hand. But these are veins that are very troublesome to women. They don't like the way they look. This is totally cosmetic. This is not a health issue. And again, with local anesthetic, we can inject these veins and remove the parts that need to come out. And you can see the result. This is about 8 weeks later, same exact hand. I know it's the same person for two reasons. One, they're wearing the same watch. And two, this happens to be my wife. So, she decided she needed some benefit having being married to a vascular surgeon. So this is what she asked for. We deal with veins on the face a lot. Again, totally cosmetic. These are veins that we see, again, mainly women want these fixed. People get them around the temporal area next to their eye. They get them on their forehead. We tend to see it on the lip. And they're just cosmetically unacceptable to people. Good news, right here in the office, this vein can be injected and sealed off. When it comes to fixing these things, though, and I'm going to show you, you definitely need to know what you're doing, because these veins on the surface are definitely connected to veins which, in this case, are connected to the veins that drain into the skull and into the brain. And so if you don't know what you're doing in these situations, patients and physicians can definitely get into trouble. Another common scenario that we see. This is a gentleman with rosacea of the nose and these very, very dense veins that he was very, very self-conscious about. These we treat in the office also. These tend not to respond to lasers. I know a lot of people and patients who have gone to the dermatologist before coming to see me, and laser tends not to work well on the nose like this. So we actually have a machine that has a fine needle that it can ablate these very, very small but cosmetically unacceptable veins in the nose. And these patients are very pleased with the way it looks at the end. So like I was mentioning earlier, there's a vein doctor, a quote vein specialist on every corner in Bergen County. I think you need to be careful. Like I said, these things look so simple on the surface. There's a lot that goes into it in terms of the treatment. Like I said, veins in the leg, we don't want to wind up with a nerve injury. We don't want to wind up with a blood clot. We don't want to wind up with an injury to one of the nearby arteries. When it comes to veins in the face, if you don't know what you're doing, you're going to get into trouble. Either cosmetically unacceptable results, or worst case scenario is causing thrombosis or a blood clot in the brain. So it's very important that whoever you choose, if you care to ever have intervention in terms of your veins or just even an evaluation, you certainly want to know exactly who you're getting involved with. It came to the point in Florida, they were even worse than New Jersey. On every street corner was another quote vein specialist because it can be quite lucrative for people to take advantage of patients. Patients being told you're going to have a stroke, you can lose your leg if you don't have your veins treated. And like I told you earlier, and I'll stand by it, is nobody is having a stroke, nobody's losing their leg, no one's having a heart attack from their varicose veins. So people were being kind of scared into having treatments. They warn in this statement from the Attorney General of Florida, beware when people claim this is a unique, a permanent, a painless, or absolutely safe treatment. None of those things are true, and you have to sit and really inform patients so they have a clear understanding of what they're getting into. That being said, that's not meant to scare you off from having your veins treated. Like I said, 99% of these things are done in our office, a local anesthetic, walk in, walk out, and patients are typically very pleased. So I want to thank you all for your attention today. I thank my partners. I work closely with my two partners for 20 years now, Dr. Bernheim, Dr. Patel. We treat a whole spectrum of vascular diseases, everything from carotid arteries to aneurysms. But our vein practice is what I specialize in and spend a good part of my career dedicated to. So at this point, I think we're ready to open up to questions.
Yeah, we'll give everyone 1 minute to put any questions if there's any.
There must be one question.
Well, then I have a question. Are you taking new patients, doctor?
I'm sorry?
Are you taking new patients?
Absolutely. I'm here in the office 3.5 days a week, seeing patients, new patients, old patients, doing procedures. My other time, the other 1.5 days, I spend at Valley Hospital seeing patients and operating, but all the vein patients are seen in our office. And
All right. We have here a few questions coming in.
hey.
Since there we go. Yeah. So we're asking for kind of an average cost, since it's a cosmetic procedure that you spoke about.
Excellent. excellent question. One that's difficult to answer. When it comes to cosmetics, it really depends again, the extent, sclerotherapy versus the phlebectomy, which is removing those large veins, to people needing catheter ablation. But what I would say is I think people are pleasantly surprised with how affordable we make it for people. In terms of causing pain in the feet, absolutely. There's a lot of reasons for having pain in your feet, though. Everybody, we all look down, doesn't matter how healthy or unhealthy you are. Our feet have a normal pattern of veins. So those veins by themselves aren't an issue, but they can become enlarged, they can become abnormal, they can cause discoloration, they can cause itchiness, they can cause discomfort, those veins. So that's where a full evaluation comes in. But yeah, I get a lot of complaints of pain in the feet from varicose veins. And that becomes a medical issue. Like I said, if you're having the signs and symptoms related to your veins, you're no longer in the cosmetic end of things. And I'd say probably 70% of the veins that I treat, at least in my practice, are really medically related. People don't realize. They come in, they don't like their veins, but when you talk to them and they start telling you, yeah, my ankle swells a little and my skin's so itchy, well, now it's not just a cosmetic problem. So it's always worth, if you're troubled by them or you have answers, see somebody, get them checked out. Don't eat our veins. That's an excellent question. I get that one every time I tell patients about a procedure. So great question. We have hundreds and hundreds of veins in our leg. The superficial veins that you see under your skin, that is not the main drainage of your leg. If you go back to one of my first slides, and I should have made it more clear, the deep veins, those are the ones that are very large, like I described, the size of my thumb. Those are the ones buried deep down in the muscle. Those are the ones that drain your leg. So by dealing with the veins on your skin, under your skin, like we're talking about, all you're doing there, what happens instantly, as soon as that vein is sealed, removed, or however we choose to treat it, that blood instantly travels down into the deep veins, which is where you want it to go, and straight out the leg. So you're actually improving the situation by dealing with abnormal veins. Is it true women make their varicose veins worse by wearing knee-high stockings? Absolutely not. Everybody says, oh, but their stockings are going to cut off my circulation. With rare exception, you will not cut off your circulation wearing knee-high compression socks for your veins. Should you be concerned about veins getting twisted around your ankles? Again, it could be merely cosmetic. It could be a normal pattern of veins, or it could be very abnormal, and they could be causing symptoms. So I don't know if I would say concerned, but certainly if they're causing an issue or you don't like them, then be evaluated. Oh, can you post your contact info at the end again? Absolutely. Put that right there. I hope that's showing up properly. But you can also just get me through the Valley Health website, valleyhealth.com. Make a little ploy for valleyhealth.com. Under Find a Physician, you can type my name in there and it'll come right up. Or certainly a good Google search.
All right. Thank you so much. That was a wonderful and much needed